Good morning, everyone. This is SPED 241 Psychoeducational Assessment of Children with Intellectual Disabilities, Illustrative Case Reports. Now, this chapter is the culmination of all the information being presented on how to write assessment reports. Hi, everyone. I'm Wendy. I used to be a SPED teacher in Singapore for 9 years, and now we have put up a little therapy center here in Palomaloc, and I'm also a mother of a child with special needs. Now I'm excited to tell you how case reports has helped me as a teacher and as a mother. Now, ano ba itong illustrative case reports? Now, these are professional narratives that provide feedback on clinical practice guidelines. These are in-depth or intensive studies of a single individual or group and are primarily descriptive. They can be shared for medical, scientific, or educational purposes. So, case report is actually same lang siya ng case studies. However, we use the term case report if we are doing it for clinical practice. Now, in this session, we're going to be focusing on psychoeducational assessment. A little review. It's a comprehensive evaluation of the mental processes that govern academic, social, and personal achievement. This detailed assessment is equally valuable for identifying high-achieving students or yung mga gifted and those who struggle with learning or behavioral impairments. Now, these assessments are key diagnostic tool for identifying children with neurodevelopmental issues, which are ADHD or Attention Deficit Hyperactivity Disorder, Autism Spectrum Disorder, Learning Disability, Intellectual Disability, and those with psychological or conduct disorders like anxiety, depression, Oppositional Defiant Disorder, etc. Now, this psychoeducational assessment may look intimidating at first. However, if understood correctly, this can actually lead to more effective teaching methods and greater student success. Now, what does it do? This assessment measures intellectual functioning, behavioral functioning, social emotional functioning, adaptive skills, and academic abilities. Now, for us to be able to understand how to write a psychoeducational assessment, we're gonna go through this 5 sections. While not all assessments look the same, they tend to follow a similar pattern. Now, first component is the referral and background section. Now, first out of 5 assessment components in the report is the referral and background section. Here, teacher involvement is especially important, showing this early stage, teacher involvement is especially important during this early stage. Now here, you can see the reasons for referral, like what are the concerns, how the student is coping in the classroom, why, or knowing about where the student is coming, and other factors that may have an impact on their learning is extremely important in order to make an accurate diagnosis. Now, in this section, you're going to find the student health, developmental history, family history, educational strategies, and report cards. So basically, in referral and background, you're going to find the child's personal data and background information of his learning, and you're going to find referrals, reasons why you are doing this assessment. Now, here's an example. Illustrative case report 1, cognitive and educational evaluation. Student name is Martha Downing, age 11 years, 10 months, grade 5.7 school, Green Acres Country Day, and evaluator would be Nancy Mather, PhD. Now, reasons for referral. Miss Suzanne Dobson, a certified special education teacher, referred Martha for an evaluation. Miss Dobson currently tutors Martha after school on a daily basis. She wished to obtain a better understanding of Martha's educational needs, any factors that were interfering with educational development, and her present performance levels in academic subjects. Now we can see here that the reason for referral is their concern is about Martha's educational needs, and if there is a need for her to be placed in a special school. Questions were also raised about the need for Martha to attend a special school or a special program to address her unique learning needs. Ms. Dobson was also interested in programs and instructional techniques that would be the most effective for helping Martha to improve her basic skills. So you can find, in this section, you're going to find important personal information about the student that you will be assessing. Okay, and then the second component for psychoeducational assessment would be the assessment. No? In this section walks us through how the assessment was completed. It may sound surprising, but many students actually enjoy and look forward to the testing. It's a one-on-one test where they can get to do something that they don't typically get to do when they are exposed to items and questions that you wouldn't get in a regular class. Now, not like a typical classroom test, in psychoeducational assessment, the child doesn't require any studying beforehand. It's a challenging activity for the student and psychologist or whoever would be administering the test to tackle together. The goal is to assess students when they are at their best, not fatigued nor distracted, and it can be completed in a 3-hour session or a multiple sessions. Now, you can find here in this section a list of assessment tools, measures, questionnaires. These tools vary on a case-by-case basis and are selected based on what the referral question was. Now, example here, tests administered in Martha's case was Woodcock-Johnson 3 or 3rd edition, tests of cognitive ability, Woodcock-Johnson 3, tests of achievement, diagnostic supplement to the tests of cognitive abilities, key math revised normative update. Now remember, the reason for referral for Martha is because of the concern of her learning needs and whether there's a need for her to be placed in a special school. So the reason for this assessment is to see or to measure cognitive abilities and scholastic aptitudes of Martha. Now, third component would be the behavioral observation and impression. Now, what's included in this section? Behavioral observations and impressions summarizes how the student performed during an assessment. It includes things like their response style, attention span, and feelings towards the assessment. Now here, you get to observe whether the student were they impulsive with their response style? Were they more deliberate and thoughtful? Did they take a long time? Did they use a trial and error approach? Was it easy for him to pay attention? Did he need lots of breaks? Were they motivated? Or is this student seemed very eager to please? Or did they give up easily? Now this section is crucial to the overall assessment because it determines the validity of the results. So, if you feel like the student was giving up easily or they were very nervous, you may stop and say that you don't want to put anything in your report that's not true. So you want to know if this is the best they can do. Remember, so assessment, our goal there is to evaluate the child at their best, no? Not when they are not feeling well, or not when they are distracted or fatigued. This assessment represents the child's intellectual functioning at this point in time. So you may stop if you don't feel like the child is doing or giving the best that he can. Example, this is how we are to write behavioral observations. Martha was cooperative throughout all testing sessions, and she generally appeared at ease, comfortable, and attentive. She was willing to attempt all tasks and maintained a positive attitude even as the tasks increased in difficulty. On several occasions, she was briefly distracted by noises in the environment, but was quickly redirected to the task by the evaluator. Martha commented that she liked school and her teachers and did not mind spending so much time each day on homework. Okay, now this is the fourth component when doing a psychoeducational assessment. Test results and interpretation. Test results and interpretations include scores achieved in areas such as reasoning and thinking ability, visual processing, memory, attention, intellectual functioning. These results often display as standard scores, percentile ranks, or in descriptive terms like above or below average. The possible outcome of an assessment is a diagnosis of a learning disability or learning disabilities. The first time you'll come across a diagnosis is in this section. True or the interpretation portion of this section takes those scores one step further by telling teachers how the scores translate in a classroom setting. So you're going to find here the standard score results and the descriptive terms like if it is below 70, then it's very low, or if the result is higher than 131, that means the child is very superior. No? So you have very low, low, low average, average, high average, superior, and very superior. Okay. Now, these are the examples on how you are going to explain how you have come up with those results. And you may elaborate more on the cognitive assessment results depending on what kind of test you are doing. Okay. Now we have your visual, spatial thinking and fluid reasoning. So these are the results. Okay. For memory, cognitive efficiency, perceptual speed, and rapid picture naming. Okay, academic results, assessment results for reading and writing, mathematics, and the scaled score. Okay, now we are down to our last component in doing a psychoeducational assessment, which is the summary and recommendations. Summary and recommendations, okay, now if you only have 5 minutes to review an assessment, the summary and recommendations should be where you start. It provides a general summary of how the student performed, where the child's strengths and needs are, and what should be done next. It gives you a bird's eye view of how this child learns best. You're going to get a lot of descriptive language about the student's profile. Where are their strengths that we can maximize and focus on in the classroom, and where are some of those needs that we really need to implement some supports and strategies to meet. Now, for the recommendations, this section focuses on tips and action steps. It provides recommendations for not only teachers but parents as well. Having teachers and parents on the same page is important because it ensures consistency for the students. Now, these are the examples of doing summary. You can also write their summary and conclusion. Martha is an 11-year-old girl with average general intellectual ability and oral language abilities. Her knowledge of general world information and school-related information are within the average range for her grade peers. No, so you're gonna have to write down here a general, like, bird's eye view of who the child is and ano yung mga strengths and weaknesses niya. And then you're gonna write down the result of your evaluation. Remember, the reason for referral to do a psychoeducational assessment for this student, Martha, is for the reason that the teacher needs to know her learning needs and if there's a need for her to be placed in a special school. Now, these are the recommendations. General recommendation: because Martha works hard and wants to succeed, provide frequent praise and reinforcement, commending her for her hard work and effort. No, so you can write down here some strategies or ideas that you want to share on how to help the child improve in her weaknesses. After doing the assessment, no, sa example natin dito, they found out that Martha is at par, no? She has general world knowledge about information, and she's doing good in reading and writing. However, she shows some significant weakness in mathematical concepts. So, yung problem niya is more on the mathematics, no? And then your recommendation would be about how to help her improve in that area. Now, placement and educational therapy. Martha will continue to profit from instruction in a general education classroom as her intellectual abilities and her levels of performance in reading and writing are commensurate with those of her peers. No, remember, during sa referral time, the concern was whether to place Martha in a special school. And then here's a recommendation. It says na no need because she can still benefit, she can still continue in a general education, but with accommodations. Okay? Now, ito na yung further assessment and accommodations. Okay. Now, I have here some samples of my own students kasi this sample from the book is Western, no? So maybe maybe we could relate more if it's from ang example is sa Philippine setting. Now here, done by a developmental pediatrician. Behavioral observation. The child was interested and frequently looked at the examiner. However, eye contact was fleeting or brief, especially once she was spoken to. She covered her ears instantly when the examiner tried to sing a nursery rhyme several times. She also was afraid of entering the adjacent testing room because she was bothered by the loud sound coming from the strong air blown by a fan exhaust and the air condition inside the room. When given testing materials, now the child immediately lined them up repeatedly. She returned the test materials when asked from her. So ang impression dito that the child has ASD or Autism Spectrum Disorder. So what are the recommendations? Ito yung issues, ito yung concerns. So what are the recommendations? So we can see here that the evaluator has itemized some ideas, strategies that parents and the teacher could do to help the child with ASD. So this one also is for a child with autism, and these are the recommendations. Okay, here naman is sample of a psychoeducational assessment, no? And then the child was at risk of ADHD or attention deficit hyperactivity disorder. So these are the recommendations that the parents and the teachers could use to help the child improve in her behavior and learning development. Okay, now what's the value? What's the importance of having this psychoeducational assessment? Now, all of these psychoeducational assessments are ideally completed at an early age and are still incredibly useful as the child moves through the school system. Now, in the future, some of the academic needs may have changed by that time, but some of the strategies that overall bird's eye view descriptive information will be so helpful for the classroom teacher who's wondering about how do I best approach my student who may have a learning disability. Now, all this information obtained or contained in this report can help us now and several years in the future. It is up to the classroom teacher to use the assessment in their update of a child's individual education plan or IEP. So it's very useful, mga teachers, and even for the parents, reviewing your child's psychoeducational assessment would give you an idea on how to help your child learn best. What are their strengths and what are their weaknesses? Okay. So, yep. So these are my references. Okay. Now, yep, please subscribe to my channel, Teacher Mommy. If you want to know more on the strategies that we use in helping children with special needs, especially in early intervention and for children with autism and ADHD and other sensory and behavioral issues. So thank you, everyone. God bless.